What makes you so excited and committed and interested in working with myositis patients and researching myositis ILD?
Wow, that's a great question. I have really felt like I'm incredibly fortunate to have been in a field where I take care of incredibly wonderful people and help them get through difficult periods of their lives. The diagnosis of myositis, particularly with interstitial lung diseases, can be really devastating. And yet, this is a group of people who are just incredibly motivated to get better, to do what they need to do in order to return to their prior state of health. I'm also really excited because even over the now almost 25 years that I've been doing this, the opportunities for treatment have gotten so much better. And we're seeing the outcomes for our patients just improve really dramatically in the course of just a couple decades. And, I think that the thing that keeps me motivated is that I know that this is a trend towards us getting better and better at taking care of our patients. And hopefully, even within my lifetime as a physician, I'll see us get to a point where, if not a cure, we'll have a really, really good treatment that will allow people to live long and meaningful lives with myositis-associated ILD.
Do you have a story about a particular patient who made a big impact on your career and interest in myositis?
Well, I think that for many doctors, our introduction to a field, even before we really know what it is an individual patient. And very, very early in my career, I took care of an absolutely wonderful man who was retiring as a school teacher. He'd been a high school teacher, and he was retiring and wanted to work in his garden. And shortly after he retired, he noticed that when he was trying to carry bags of mulch in his garden, that he didn't have the strength and that he was short of breath. And this was sort of how he discovered that he had myositis associated ILD. This was now almost 25 years ago, and our understanding was much less robust than it is now. But my long-term relationship with that patient, my working with him to try to find the therapies that would help him live the longest with the highest quality of life, really were that was a very essential relationship to making me want to have this as a life focus, as a career focus. And so, really, every day that I go to work, I think about this patient. Many people will say, how can that possibly be? But the reality is each of our patients really touches us and creates for us a sense that we have to do better. We have to find answers. We have to improve the care that we're providing. And this gentleman really had that impact on me. And, he still is somebody I think about on a very regular basis, and continue to try to push forward with our care for patients with myositis-associated ILD, because we want every person to live the fullest life they possibly can. And I was so struck by how he had given his life to teaching our students in the Baltimore City area, and that his only goals were really to be active after he retired, and this interfered with it. And fortunately, we were able to treat him and to give him back that period of time to do the things that he wanted to do. And that's what I'd like to do for every patient.
What hopeful signs do you see in the care of those who are affected by myositis ILD?
Well, I think this is obviously nobody wants to have myositis associated ILD. Nobody wants to be ill in any way. But this is a period of time where the discoveries are coming at such a rapid rate, and the understanding of the disease, the ability to identify patients who have myositis associated ILD, and the ability to treat it is just improving practically, I mean, certainly year by year, but maybe even by month by month. And a lot of this has to do with, firstly, improved diagnostics to be able to identify patients who have myositis-associated ILD. One of the things that some people may not appreciate is that although the name is myositis, so it focuses on muscle inflammation, for a lot of patients who have interstitial lung disease, they may really not have a lot of muscle disease, at least when they first present. And so for many years, a big challenge was actually recognizing what was causing their interstitial lung disease. Now, as diagnostic tests for myositis autoantibodies have improved, we can, we're much, much better at identifying people, even if they don't have the overt muscle weakness or the rash that we associate with dermatomyositis. So firstly, being able to tell what kind of interstitial lung disease a person has is very important because it allows us to go down the right pathway in terms of treatment. And now that we can identify people, we can treat them sooner. And in addition to being able to treat them sooner, there are just more and more options in terms of therapeutics that seem to have really important efficacy or effectiveness in patients who have myositis-associated ILD. So I think that not only is this an exciting time right now, but that the future holds the likelihood that firstly we'll be able to identify patients much more quickly when they present with ILD and have myositis, and that the therapeutic options will be greater because everybody's a little different. What works for one person might not work for another person. And that as a community, the myositis community, the dermatologists, the rheumatologists, the neurologists, the physical medicine and rehabilitation physicians, we all work together really well. It's a truly multidisciplinary approach. And I think with that the likelihood of both improved survival, improved quality of life is really going to be exceptionally good as we move into the next decade.
Do you have any advice for people who are newly diagnosed?
Absolutely. I think that perhaps the most challenging point of time is at the time of diagnosis because often it's a time where there's a lot of physical changes that somebody who has maybe been completely independent and able to do everything they wanted to do is suddenly noticing that they get short of breath doing things that they could have done easily before. Maybe they're troubled by a nagging cough or some other symptoms that make them aware that their breathing is not appropriate. And I think that there's a lot of sort of fear in that moment. Once a diagnosis of interstitial lung disease is made, it can be really overwhelming because there's just a huge amount of information on the internet. A lot of it is just not applicable to our patients who have myositis-associated ILD. And so I think that getting that kind of good quality information is very important. And, fortunately, the Myositis Association has a wonderful website with a lot of really critical information on it. I'd also encourage people to look at some of the support organizations also for interstitial lung disease, which might include the Pulmonary Fibrosis Foundation, which has a lot of information as well. And then there's also NIH resources. So the NIH has a patient information section as well on their website. And then I think that the other part that can be very helpful is actually being a part of a support group because our patients really learn a tremendous amount from each other. And for many of the practical questions, how do you manage? Perhaps you have to use supplemental oxygen. How do you manage your oxygen? How do you arrange to have enough oxygen if you have to go to a clinic visit that's 3 or 4 hours away from where you live? Our patients are very, very supportive of each other. They're incredibly clever. They teach each other how you negotiate a life that is sometimes changed by the needs that you have with an interstitial lung disease. And so I think that getting good information, being involved with a support group, and also trying to find doctors who are specialists in certainly interstitial lung disease, but preferably in myositis-associated interstitial lung disease, because interstitial lung disease encompasses a lot of different disease types. And there are some things which are pretty unique to patients who have myositis and ILD. So there are a number of centers across the US that are ILD specialists. There are a number of centers that are myositis specialists, and then there's some that are both. And I think that trying to get information from a variety of experts to try to help figure out sort of what are the best choices that you have as an individual, and also what are the things that are going to likely help you over the long run, not just dealing with it, the immediate needs, but how are you going to be the strongest and the healthiest over the long run? And I think that it really takes that kind of integrated care between knowledge, support, and good clinical care to achieve the best outcomes.
You've been an active member of TMA's medical advisory board and a big supporter of TMA's work. What value do you think TMA has to offer the medical community and the patient community?
Thanks for that question. I think that, especially when you have a rare disease, it can be very hard to find the information that you need. If you have a disease where a million other people have it, there's a lot of information. But when you have a rare disease, it's a little bit more challenging to find not only information, but good quality information. And so, from the patient standpoint, I think that the Myositis Association is really critical because it really convenes people who are experts. It creates content that is very, very high quality and is directed to patients specifically. So I think that it provides a resource that can be challenging to get to if you didn't have an organization like TMA. For physicians, TMA is like it's like a catalyst. It's something that makes things work better. It brings together people who have expertise in different areas of myositis, and it helps them speak to each other to work in a coherent way. I also think it's incredibly important that TMA supports research studies in myositis, including myositis-associated ILD. And without research, we'll never understand these diseases, and we'll never find better therapies. So TMA is really, it's it's a jewel because it brings together people. It makes this disease something that is easier to approach from the standpoint of a patient, and it makes the ability to produce new research to make this disease more treatable possible for clinicians and scientists. So I've been very, very fortunate and pleased to be able to have this association with TMA.